Oakville.
Thank you, Speaker. I've got a question this morning for the Minister of Child and Youth Services. We're all aware in this House that this is Child and Youth Mental Health Week across the country. Today, almost 1 in 5 children suffer from a mental health illness. Approximately 70% of all mental health illnesses begin in childhood. We're all aware of the importance of providing our children and youth with the right supports when it comes to their mental health. In my own community of Oakville, this is a concern I hear often from my constituents. So, Speaker, would the Minister please tell us in the House what we are doing in this year's budget to ensure that the mental health, specifically of Ontario's children and youth, is being looked after?
Thank you. Minister.
I'm waiting. It's all right, go ahead. Thank you, Speaker, and I'd like to thank the member from Oakville for bringing up this very important issue today, especially this week. Later today, I will be delivering a statement on how mental health issues affect our families and communities, and also how this government has made providing the right support a top priority. I'm extremely proud that in this year's budget, funding for the comprehensive mental health and addiction strategy is increasing to $93 million annually. This budget's investment is necessary to give young people the essential supports they need. The investment in this budget will help to deliver services when and where children and youth need them.
Thank you. Supplementary.
Thank you, Speaker, and thank you to the Minister for that answer. I'm glad to hear this government's made a strong commitment in this budget to the mental health and children of youth in Ontario, because it's sorely needed. I know that in my community of Oakville, frontline mental health services and programs that are available to young people can make a huge difference in their daily lives. Those services that are able to engage youth can make a big impact in the path that they decide to take and on the road to their recovery. So helping young people realize they're not alone can literally, in this case, mean the difference between life and death. The question is, Speaker, what is the government doing to ensure that more frontline services will be available to all of Ontario's youth?
Mr. Children and Youth Services.
Thank you. Speaker, our government has made progress in our mental health and addiction strategy. In the last year, my ministry has made significant investments to ensure that all children and youth have timely access to frontline services. 456 new mental health workers were placed in communities across the province to go along with 144 new mental health nurses in schools. I have been to some of these centres that provide the services. I have worked to these workers. These services work and are needed in our schools. As well, my ministry is hiring 80 new Aboriginal mental health and addiction workers for high-needs Aboriginal communities. Our investments, Speaker, will help over 35,000 young people across the province. We are proud of these achievements, and through this year's budget, we will continue to move forward.
No question.